This is the specimen of liver. The liver is a wedge-shaped organ which is situated in the right hypochondrium, epigastrium, and extends into the left hypochondrium. The liver has 5 surfaces. This is the anterior surface. This is the superior surface. Then this is the right lateral surface, posterior surface, and inferior surface. The posterior-inferior surface together known as the visceral surface. These surfaces are more or less continuous with each other. There is only one sharp border, and that is the inferior border. So this is the inferior border. The inferior border separates anterior surface from the inferior surface anteriorly, and on the right side it also separates the inferior surface from the right surface. Along the inferior border we can see 2 notches. This notch is known as the interlobar notch or the notch for ligamentum teres. So this is the notch for the ligamentum teres or interlobar notch, and to the right of it there is another notch here. This is the cystic notch which lodges the fundus of gallbladder. So if we see from anterior side, this is the interlobar notch or notch for ligamentum teres, and this is the cystic notch which lodges the fundus of gallbladder. Along the anterior and superior surface here we can see the attachment of falciform ligament. So this is the falciform ligament along the anterior surface and superior surface. On the posterior surface we can see a fissure here. This fissure is fissure for ligamentum venosum. In the floor of this fissure we can see the ligamentum venosum. The ligamentum venosum is a remnant of ductus venosus of the fetal life. In the fetal circulation, the ductus venosus carried oxygenated blood from left branch of the portal vein to the left hepatic vein near its termination with inferior vena cava. On the inferior surface here we can see another fissure. So this fissure is a fissure for ligamentum teres which lodges this structure which is known as the ligamentum teres. The ligamentum teres is a remnant of left umbilical vein which carried oxygenated blood from the placenta towards the fetal liver. So these 2 fissures, one fissure for ligamentum venosum on posterior surface and the other fissure for ligamentum teres on the inferior surface. These 2 fissures and the attachment of the falciform ligament on the superior and anterior surface. So the plane which passes through these structures will divide the liver into 2 anatomical lobes. The part of liver on the left of this plane is the left lobe of liver, and the part of liver on the right of this plane is the right lobe of liver. So anatomically we can divide the liver into 2 lobes, anatomical right and left lobes. The right lobe is 5/6, whereas the left lobe forms the 1/6 of the liver. So if we see from the anterior aspect, so to the right of the attachment of falciform ligament is the right lobe which is larger compared to the smaller left lobe which is on the left of the attachment of falciform ligament. Other features seen on the visceral surface here, this is the fossa for the gallbladder which lodges the gallbladder. So the fossa for gallbladder is present on the inferior surface of the right lobe. On the posterior surface of the right lobe, there is a groove for inferior vena cava which lodges the upper part of the inferior vena cava. So this is the inferior vena cava present on the posterior surface of the right lobe. In anatomical position, we must keep the liver in such a way that the upper end of the inferior vena cava is directed almost upwards. The superior surface is up, the anterior surface is anteriorly, the inferior surface should be placed inferiorly and the posterior surface posteriorly, and the right surface laterally towards the right side. So this is the anatomical position in which the inferior vena cava should be facing up. Now there are two small lobes present on the right lobe. On the posterior surface, there is a lobe known as a caudate lobe. This is the caudate lobe. Whereas on the inferior surface, this smaller lobe is the quadrate lobe. Between caudate and quadrate lobe, there is an irregular, deep, transverse fissure which is known as porta hepatis. If we see the boundaries of the caudate lobe, towards the right, there is a groove for inferior vena cava. Towards the left, there is fissure for ligamentum venosum. Inferiorly, there is a porta hepatis, and above it is continuous with the superior surface. The quadrate lobe is bounded on the right by the fossa for the gallbladder, which lodges the gallbladder. To the left, this is the fissure for ligamentum teres, which lodges ligamentum teres. Anteriorly, it is bounded by inferior border, and posteriorly there is a porta hepatis. Now here we can see piercing the substance of the liver and entering into inferior vena cava. These are the hepatic veins. So these are the hepatic veins entering into inferior vena cava. Now we must identify the structures in the porta hepatis. The posterior most structure in porta hepatis is a portal vein. So this is the portal vein. In front and to the left, this is the hepatic artery. The lumen of the hepatic artery is circular, thick-walled, smallest lumen, whereas lumen of the portal vein is largest and it is thin-walled. To the right of hepatic artery, this is the hepatic duct, which has a lumen intermediate between the portal vein and the hepatic artery. So in the porta hepatis, we must identify the portal vein behind, in front of it, hepatic duct on the right and hepatic artery on the left. In addition to these structures, hepatic plexus of nerves enter the porta hepatis. A few lymphatics come out of the porta hepatis. So the main structure which enter the porta hepatis are portal vein, hepatic artery and hepatic plexus of nerves, whereas the structures which come out of the porta hepatis are the right and left hepatic ducts and few lymphatics. The right and left hepatic duct unite to form common hepatic duct, which will unite with the cystic duct coming from gallbladder, and the cystic duct and the common hepatic duct unite to form the common bile duct. So that is the porta hepatis. The margin of the porta hepatis give attachment to lesser omentum. Also, the fissure for ligamentum venosum gives attachment to lesser omentum. So the lesser omentum is attached to the liver at an L-shaped area, which is the fissure for ligamentum venosum and the margin of the porta hepatis. Now here we can see this is the caudate lobe. Below and to the right, the caudate lobe is connected to the right lobe by a process. This is the caudate process. Whereas below and to the left, this process is the papillary process. Also just adjacent to it, there is a rounded elevation present on the inferior surface of the left lobe. This is known as the omental tuberosity or tuber omental. This area is related to the lesser omentum.